therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for trans-feminine individuals, typically improves acne over time as androgens are suppressed. Many trans-feminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne-beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in trans-feminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55, Nutritional Deficiencies and Acne, Zinc, Vitamin D, Selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10 plus grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking, automotive work, and similar occupations. These oils are comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Guide 63, Acne in Patients with Liver Disease and Metabolic Disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. 2 to 3 times weekly. After allowing this to dry, wait 10 to 20 minutes, apply your moisturizer. If using retinoids, apply them now, after at least 2 to 3 weeks of tolerance building. Optional, apply occlusive oil or balm as final step if your skin is dry. Step 7. Plan your treatment introduction sequence. Never introduce multiple new treatments simultaneously. Introduce your first active treatment, perhaps salicylic acid, use it 2 to 3 times weekly for 3 to 4 weeks, then reassess. If tolerating well and seeing some improvement, after 4 weeks consider introducing a second active, perhaps benzoyl peroxide on different days/times. Build your routine gradually over 8 to 12 weeks. This patience is rewarded with better long-term results than aggressive starting. Step 8. Plan adjustments based on response. After 8 to 12 weeks of consistent treatment, reassess. Is acne improving? Are side effects manageable? Do you need to increase treatment intensity? Based on your assessment, you might increase frequency of treatments, increase concentration, add another treatment, or make other adjustments. However, only adjust one variable at a time so you know what caused any changes. Step 9. Incorporate lifestyle factors. Alongside your skincare routine, implement dietary changes, reduce sugar, increase antioxidants, perhaps reduce dairy. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, exercise, or your preferred method. These factors take 4 to 8 weeks to show skin effects but provide significant benefits. Step 10. Plan professional treatments if appropriate. If after 12 weeks of diligent home care your acne hasn't adequately improved, consider professional treatments like chemical peels, laser, or blue light therapy. Monthly professional treatments combined with home care often produce better results than home care alone for moderate to severe acne. Step 11. Plan long-term maintenance. Once your acne clears, identify which treatments were essential for your success and continue them at maintenance levels. Your maintenance routine might be simpler than your treatment routine, perhaps just retinoid at night and sunscreen during the day, but it should continue indefinitely to prevent acne recurrence. Step 12. Build flexibility for adjustments. Your perfect routine isn't static. Seasonal changes, life stress changes, hormonal cycles, and other factors might necessitate routine adjustments. Have a plan for intensifying treatment during high-risk times, increased stress, menstrual cycle high-risk phase. Be willing to adjust your routine based on your skin's response rather than rigidly sticking to something not working. A sample personalized routine for moderate inflammatory acne might look like: morning, gentle cleanser niacinamide serum, optional, lightweight moisturizer SPF 30+ sunscreen. Evening, makeup removal if applicable, gentle cleanser hydrating toner/essence, optional, benzoyl peroxide 2.5%, 3 to 4 times weekly initially, moisturizer optional, retinoid, starting 2 to 3 times weekly after tolerance built. Lifestyle, 7 to 9 hours sleep, 30 minutes exercise 5 times weekly, stress management, diet emphasizing whole foods with reduced sugar. Professional, monthly superficial chemical peels if available. Timeline, 8 to 12 weeks for significant improvement, 6 months for near complete clarity. This framework is meant as guidance, not prescription. Your perfect routine will be unique to your specific acne type, skin characteristics, lifestyle, and preferences. The principle is starting conservatively, progressing gradually, incorporating evidence-based treatments, addressing lifestyle factors, and maintaining long-term consistency. This approach works because it respects your individual skin while following scientific principles of acne treatment. Remember, there's no single, best, acne treatment. There's only the best treatment for your individual skin. Finding that treatment requires some experimentation, patience, and willingness to adjust based on results. Most acne responds to consistent, appropriate treatment. Your clear skin is achievable with the right approach for you specifically. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties leads to clear, healthy skin. Your acne journey is unique, but clear skin is absolutely achievable. #20 Expert Level Skin Care and Acne Treatment Guides, Part 3. Each guide, 10 to 15 minutes reading time. Guide 31, Acne Scar Treatments, Comprehensive Guide to All Scar Types and Advanced Therapy Options. Acne scars represent permanent reminders of severe acne, but modern dermatology offers numerous treatment options that can significantly improve scarring. Understanding different scar types, appropriate treatments, realistic outcomes, and combination approaches enables you to effectively address post-acne scarring. Acne scars exist in 3 primary morphologies, each requiring different treatment approaches. Ice pick scars are deep, narrow indentations resembling puncture wounds from an ice pick. These scars have sharp edges and typically measure 1 to 4 mm in diameter but penetrate deeply into the dermis. Ice pick scars are difficult to treat because their narrow base makes many standard treatments ineffective. Boxcar scars are wider depressions with relatively flat bottoms and sharp, vertical edges. These scars typically measure 4 to 6 mm or larger in diameter. Boxcar scars appear similar to chickenpox scars. Rolling scars are shallow depressions with sloping, rounded edges creating a wave-like appearance across the skin. Rolling scars often appear worse when skin is stretched due to their tethered nature. Understanding scar depth and type guides treatment selection. Shallow scars are often more responsive to surface treatments, while deep scars require deeper penetrating treatments. Mixed scar types within the same individual require combination approaches. Prevention remains the gold standard scar treatment. Avoiding picking, squeezing, or extracting acne prevents scarring. Treating acne aggressively to minimize deep inflammation prevents scarring. For anyone prone to severe acne, considering isotretinoin to prevent scarring is appropriate if acne is severe enough to cause scarring risk. For existing scars, numerous treatments provide varying degrees of improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural collagen loss that topical products cannot reverse. However, treating associated hyperpigmentation with topical treatments makes scars less noticeable. Subcision is a minor surgical procedure particularly effective for rolling and tethered scars. A needle or small scalpel is inserted under the scar, severing fibrous tissue anchoring the scar to deeper structures. This allows the scar to elevate as new collagen forms underneath. Subcision often requires multiple treatments performed weeks apart. Results develop over months as new collagen remodels. Subcision combined with others or trigger acne. The ingredients matter significantly. Lightweight hydrating ingredients like hyaluronic acid, glycerin, and humectants hydrate without being occlusive or pore clogging. Niacinamide hydrates while also having acne-fighting properties. Centella asiatica, SICA, soothes irritation and supports skin barrier function. Ceramides strengthen your skin barrier, which is particularly important when using strong acne treatments. Avoid heavy oils and butters if you have acne-prone skin. Coconut oil, shea butter, and petroleum jelly can clog pores in susceptible individuals. However, some facial oils specifically designed for acne-prone skin can be beneficial. Jojoba oil, squalane oil, and rosehip seed oil are lightweight and non-comedogenic for most people. If you choose to use facial oil, use sparingly, just a few drops mixed into your moisturizer or applied as the last step of your routine. Texture matters when choosing a moisturizer for acne-prone skin. Lightweight gels absorb quickly and won't leave your skin feeling greasy. Hydrating lotions provide more hydration than gels while still being lightweight. Creams are heavier but may be necessary during winter or if your skin is severely dry from acne treatments. Everyone's needs are different. Experiment to find what works for you. Application technique is important. Apply moisturizer to slightly damp skin immediately after cleansing or applying treatments. This allows the moisturizer to lock in hydration from the water on your skin. Use about a quarter-sized amount for your entire face. Warm it between your palms, then gently press it into your skin using your fingertips. Don't rub or massage aggressively, as this can irritate acne lesions. Daytime and nighttime moisturizing might differ. During the day, use a lightweight gel or lotion moisturizer that won't make your skin feel greasy under makeup or throughout the day. Many people use a sunscreen as their daytime moisturizer since sunscreen provides hydration and protection simultaneously. At night, you can use a slightly richer moisturizer if desired, though many people use the same moisturizer day and night. If your skin is very dry from acne treatments, you might use the layering or sandwich method. Apply your treatment, retinoid, benzoyl peroxide, salicylic acid, wait 20 minutes, apply moisturizer, wait a few minutes, then apply another thin layer of moisturizer. This significantly reduces irritation and dryness while maintaining treatment efficacy. In winter or dry climates, increase moisturizing frequency or richness. You might apply moisturizer twice daily or use a richer nighttime formula. Some people add a facial oil, just a few drops, over their moisturizer for extra hydration during very dry periods. In summer or humid climates, you might reduce moisturizer richness, using only a lightweight gel. If your skin is extremely oily and acne-prone, you might feel you don't need moisturizer. However, most very oily skin is actually dehydrated. The skin is overproducing oil to compensate for internal dehydration. Using a lightweight hydrating moisturizer often actually reduces oil production by satisfying your skin's hydration needs. Sunscreen functions as both protection and moisturizer. Many quality sunscreens for daily use include hydrating ingredients. Use a sunscreen as your daytime moisturizer, applying it after your morning skincare routine and before makeup. Reapply every 2 hours if you'll be in the sun, or use a sunscreen powder for convenient reapplication over makeup. Hydrating masks once or twice weekly provide intense hydration, supplementing your regular moisturizer. Sheet masks or cream masks with hydrating ingredients like hyaluronic acid, glycerin, or honey can be applied for 10 to 20 minutes, then removed. This boosts hydration without requiring daily changes to your routine. It's possible to over-moisturize. Applying excessive amounts or using too rich formulas can clog pores and worsen acne. Use appropriate amounts, about quarter-sized for your face, and choose formulations suitable for your skin type. If your acne worsens after starting a new moisturizer, discontinue it and try a different product rather than assuming moisturizer itself is the problem. Guide 11. Sun Protection and UV Damage Prevention for Acne-Prone and Treated Skin. Sun protection is non-negotiable for anyone with acne or using acne treatments, yet it's frequently neglected. Understanding UV damage, sunscreen types, and proper application is essential for protecting your skin from damage while treating acne. UV radiation from the sun damages skin through multiple mechanisms. UVB rays cause sunburn and skin cancer. UVA rays penetrate deeply, causing aging, wrinkles, and skin cancer. Both types of UV radiation increase inflammation, which worsens acne. Additionally, UV exposure causes post-inflammatory hyperpigmentation, dark marks remaining after acne heals, to darken significantly and persist longer. Without sun protection, acne marks that might fade within 3 to 4 months can persist for a year or longer. Many acne treatments increase photosensitivity, making skin more susceptible to sun damage. Retinoids significantly increase UV sensitivity. Salicylic acid and benzoyl peroxide cause mild photosensitivity. Chemical exfoliants, AHAs, BHAs, increase sun sensitivity. Vitamin C also increases sensitivity in some formulations. Using any of these treatments without sun protection significantly increases sun damage risk and post-inflammatory hyperpigmentation. Sunscreen comes in 2 main types: mineral, physical, and chemical. Mineral sunscreens contain zinc oxide or titanium dioxide, which reflect UV rays. They're generally well tolerated, work immediately upon application, and rarely cause irritation. However, they can leave a white cast on skin and may feel heavy. Chemical sunscreens contain organic compounds that absorb UV rays and convert them to heat. They're typically lightweight and invisible on skin but may cause irritation in sensitive individuals and require application 15 minutes before sun exposure to be effective. For acne-prone skin, sunscreens labeled non-comedogenic or for acne-prone skin are essential. Many facial sunscreens are specifically formulated to be lightweight and non-clogging. Combination sunscreens containing both mineral and chemical ingredients often provide the best balance of effectiveness and wearability for acne-prone skin. SPF, sun protection factor, indicates protection against UVB rays. SPF 15 blocks about 93% of UVB rays, SPF 30 blocks about 97%, and SPF 50 blocks about 98%. For daily use with acne-prone skin, SPF 30 is the minimum recommended. SPF 50 provides slightly better protection if you'll be outside for extended periods. However, SPF rating says nothing about UVA protection. Ensure your sunscreen is broad spectrum, protecting against both UVA and UVB rays. Proper sunscreen application is crucial, Most people don't apply enough. You should use about 1/4 teaspoon, 5 milliliters, for your entire face. Many people use far less, reducing actual protection significantly. Warm the sunscreen between your palms and gently press it into your skin. Apply it as the final step of your morning skincare routine, before makeup if you wear it. Daily sunscreen application.
Welcome and breathe with me, in and out. Let any stress or frustration melt away for this moment. We're going to talk about acne today, not with judgment or harsh criticism, but with compassion, understanding, and practical wisdom. If you're dealing with acne, first, know this: you're not alone. You're not doing anything wrong, and your skin doesn't define your worth. Acne is incredibly common. It affects people of all ages, not just teenagers. It can be influenced by hormones, stress, genetics, and countless other factors, many of which are beyond your control. Let's approach acne treatment the way we approach all skincare, with gentleness, patience, and respect for your skin's natural processes. First, let's understand what acne actually is. Acne forms when your pores become clogged with oil, dead skin cells, and bacteria. Your skin naturally produces oil through sebaceous glands. This oil, called sebum, is actually beneficial. It moisturizes your skin and protects it. But when too much oil is produced, or when dead skin cells don't shed properly, they can combine to create a plug in your pore. This is where the trouble begins. Bacteria that normally live on your skin can multiply in this clogged pore, leading to inflammation, redness, and the formation of pimples. There are different types of acne. Whiteheads and blackheads are non-inflammatory. They're simply clogged pores without significant infection or swelling. Papules, pustules, nodules, and cysts are inflammatory. They're red, swollen, often painful, and involve bacterial infection and immune response. Understanding what type of acne you have helps guide treatment, but the fundamental approach remains the same. Be gentle, be consistent, and be patient. Let's talk about the most important principle in treating acne: gentleness. When you have acne, it's tempting to scrub hard, to use strong products, to try to force your skin to be clear. This is understandable, but counterproductive. Harsh treatment actually makes acne worse by irritating your skin, damaging its protective barrier, and triggering more oil production as your skin tries to compensate for the damage. Gentle treatment, on the other hand, helps your skin heal, maintains its barrier function, and allows effective ingredients to work without causing additional inflammation. Start with a gentle cleanser, the same type we've discussed before. Nothing harsh, nothing with scrubbing beads or gritty texture. Just a simple pH balance cleanser used twice daily. Cleanse in the morning and at night, using lukewarm water and gentle circular motions with your fingertips. This removes excess oil and impurities without traumatizing your skin. After cleansing, this is where acne treatment comes in. There are several effective ingredients for treating acne. Let's discuss the most common and accessible ones. Salicylic acid is a beta-hydroxy acid that can penetrate into your pores and help dissolve the mixture of oil and dead skin cells that causes clogs. It's excellent for blackheads and whiteheads. Start with a product containing 2% salicylic acid. This is the sweet spot for effectiveness without excessive irritation. You can find salicylic acid in cleansers, toners, serums, and spot treatments. Benzoyl peroxide kills acne-causing bacteria and helps remove dead skin cells. It's particularly effective for inflammatory acne, those red, swollen pimples. Start with 2.5% concentration. Studies show that lower concentrations are just as effective as higher ones, but cause less irritation. You can always increase if needed, but begin gently. Niacinamide is a form of vitamin B3 that reduces inflammation, regulates oil production, and helps fade post-acne marks. It's gentle and suitable for all skin types. Look for products with 5 to 10% niacinamide. This ingredient plays well with others and is an excellent addition to any acne routine. Retinoids derived from vitamin A are powerful for preventing clogged pores and speeding up skin cell turnover. Over-the-counter retinol is available in various strengths. For prescription-strength retinoids, you'll need to see a dermatologist. Start with a low concentration and use only a few times per week at first, gradually increasing frequency as your skin adjusts. Here's how to build a simple, effective acne routine. Morning. Cleanse gently. Apply a product with niacinamide or salicylic acid. Follow with a lightweight, oil-free moisturizer. Finish with sunscreen. This is crucial because some acne treatments make your skin more sensitive to the sun, and sun exposure can darken acne marks. Evening. Cleanse gently. Apply your acne treatment. This might be benzoyl peroxide, a retinoid, or salicylic acid. Wait a few minutes for it to absorb. Follow with moisturizer. Notice that moisturizer appears in both routines. Even oily, acne-prone skin needs moisture. When your skin is dehydrated, it actually produces more oil to compensate. Moisturizer helps maintain your skin's barrier function, which is essential for healing. Choose an oil-free, non-comedogenic moisturizer that won't clog your pores. Now let's address what not to do. These are common mistakes that can make acne worse. Don't pick, pop, or squeeze your pimples. This is perhaps the hardest rule to follow because the urge to pick is strong, especially when a pimple is right there on your face. But picking introduces bacteria from your fingers, causes trauma that leads to scarring, spreads infection to surrounding skin, and prolongs healing time. When you feel the urge to pick, take a deep breath. Apply a spot treatment instead. Occupy your hands with something else. Put a small hydrocolloid patch over the pimple if you can't resist touching it. Don't use multiple harsh products at once. It's tempting to throw everything at your acne. Salicylic acid, benzoyl peroxide, retinoids, strong acids, all at the same time. This will only irritate and damage your skin. Choose 1 or 2 active ingredients and use them consistently. You can combine products, but do so thoughtfully. For example, salicylic acid in the morning and retinoid at night is a common, effective combination. But using 3 strong products all at once will likely cause redness, peeling, and actually worsen your acne. Don't expect instant results. This is crucial to understand. Acne treatment takes time. You won't see significant improvement for at least 4 to 6 weeks, sometimes longer. Your skin needs time to turn over, for clogged pores to clear, for inflammation to reduce. Consistency over weeks and months is what produces results, not intensity over days. Let's talk about lifestyle factors, because acne isn't only about what you put on your skin. Stress affects acne significantly. When you're stressed, your body produces more cortisol, which can increase oil production and inflammation. While you can't eliminate stress entirely, managing it through breathing exercises, adequate sleep, gentle exercise, and activities you enjoy can help improve your skin. The connection between stress and acne is real and significant. Sleep matters. During sleep, your body repairs and regenerates, including your skin. Poor sleep disrupts this process and can worsen acne. Aim for 7 to 9 hours of quality sleep. Keep your bedroom cool and dark. Change your pillowcase regularly. Once or twice a week is ideal because pillowcases accumulate oil and bacteria. Diet's role in acne is debated, but certain patterns emerge in research. High glycemic foods, sugary, processed foods, may worsen acne for some people. Dairy, particularly skim milk, has been linked to acne in some studies. However, diet doesn't affect everyone's acne equally. Pay attention to your own patterns. If you notice your skin worsens after certain foods, it's worth adjusting your diet. But don't restrict yourself unnecessarily or blame your diet entirely. Acne is complex and multifactorial. Stay hydrated. Water supports every system in your body, including your skin's ability to heal and maintain its barrier. Aim for adequate water intake throughout the day. Now let's address the emotional impact of acne, because this is just as important as the physical treatment. Welcome to this compassionate space. Breathe slowly and deeply, centering yourself in calm. Today we're talking about hormonal acne and how to deal with it gently, a topic that affects many people and requires understanding, patience, and a multifaceted approach. Hormonal acne is acne driven primarily by hormonal fluctuations. It typically appears along the jawline, chin, and lower cheeks, though it can occur anywhere. It often flares in predictable patterns: before menstruation, during pregnancy, postpartum, during perimenopause, or when starting or stopping hormonal birth control. Understanding the hormonal connection helps you approach this type of acne with realistic expectations. Hormones, particularly androgens, increase sebum production and can cause inflammation in skin. When these hormones fluctuate, acne often follows. This is biological, not a failure of your skincare routine. Hormonal acne requires patience because topical treatments alone often aren't sufficient. You're addressing an internal trigger manifesting externally. Both internal and external approaches work best in combination. Let's start with topical care for hormonal acne. The basics remain essential: gentle cleansing, appropriate treatment, moisturization, and sun protection. Use a mild cleanser once daily in the evening. Avoid harsh stripping products that damage your barrier and make skin more reactive. For treatment, several ingredients help hormonal acne. Salicylic acid penetrates pores and reduces oil buildup. Use 0.52% concentration 3-4 times weekly. Benzoyl peroxide kills bacteria that worsen acne. Use 2.5% concentration as needed on breakout-prone areas. Retinoids are particularly effective for hormonal acne. They regulate cell turnover, unclog pores, and reduce inflammation. Over-the-counter adapalene or prescription tretinoin, use 3-4 times weekly or as tolerated, can significantly improve hormonal breakouts. Be patient. Retinoids take 3 to 6 months to show full effects. Niacinamide at 5% helps regulate oil, reduce inflammation, and support barrier function. It can be used twice daily and is gentle enough for sensitive skin. Azelaic acid has both antibacterial and anti-inflammatory properties. A product with 10 to 20% azelaic acid can help manage hormonal breakouts. Apply treatments consistently, but always follow with moisturizer. Hormonal acne doesn't mean you should skip hydration. Healthy barrier function supports clearer skin. Now let's discuss internal approaches. For many people with hormonal acne, topical treatments alone aren't enough because the trigger is internal. Hormonal birth control is one option for managing hormonal acne in women. Certain oral contraceptives that contain estrogen and progestin can regulate hormones and significantly reduce acne. This requires a prescription and discussion with a healthcare provider about whether it's appropriate for you. Benefits can include clearer skin, but there are potential side effects to consider. Spironolactone is an anti-androgen medication that blocks the effects of testosterone on skin, reducing oil production and acne. It's used off-label for hormonal acne in women and can be very effective. This requires a prescription and monitoring by a healthcare provider. It's not suitable for everyone. Pregnant women or those planning pregnancy cannot use it. For severe or cystic hormonal acne, a dermatologist might recommend isotretinoin. This powerful medication can permanently change how your skin produces oil. It requires careful monitoring due to significant side effects, but can be life-changing for severe cases. Supplements that some people find helpful include evening primrose oil, which may help regulate hormones, spearmint tea, which some studies suggest may reduce androgens, omega-3 fatty acids, which reduce inflammation, and DEM, diindolylmethane, which may support estrogen metabolism. Always consult a healthcare provider before starting supplements. Lifestyle factors significantly affect hormonal acne. Manage stress, which increases cortisol and can worsen hormonal imbalances. Practice stress reduction techniques regularly. Meditation, yoga, deep breathing, time in nature, creative expression. Sleep adequately and consistently. Sleep disruption affects hormones significantly, including those that influence skin. Exercise regularly, which helps balance hormones naturally. But cleanse promptly after sweating to prevent additional breakouts. Evaluate your diet. Some people find that dairy worsens hormonal acne due to hormones naturally present in milk. High glycemic foods may increase insulin and affect hormones. Consider eliminating these for a month to see if your skin improves. Eat foods that support hormonal balance. Cruciferous vegetables like broccoli and cauliflower support estrogen metabolism. Foods rich in zinc support skin health and hormone balance. Probiotic-rich foods support gut health, which affects hormones. Anti-inflammatory foods reduce overall inflammation. Stay hydrated to support all bodily functions, including hormone regulation. Track your cycle if you menstruate. Notice when breakouts typically occur. This helps you anticipate flares and adjust your skincare accordingly. You might use more targeted treatments during the week before your period when you know breakouts are likely. Be extra gentle with your skin during hormonal flare periods. Don't overtreat or use harsh products in frustration. Gentle consistency works better than aggressive intervention. Address underlying conditions if present. PCOS, polycystic ovary syndrome, often causes hormonal acne. If you have other symptoms, irregular periods, excess hair growth, weight gain, consult a healthcare provider about possible PCOS. Treating the underlying condition helps clear the acne. Thyroid disorders can also affect skin and hormone balance. If you have symptoms beyond acne, get your thyroid checked. Don't pick or squeeze hormonal breakouts, which are often deeper and more inflamed than other acne. Picking causes scarring and worsens inflammation. Keep everything that touches your face clean. Change pillowcases frequently, clean your phone, wash makeup brushes regularly. Be patient with treatment. Hormonal acne takes time to improve. Topical treatments need 6 to 12 weeks to show results. Hormonal treatments like birth control or spironolactone can take 3 to 6 months to demonstrate full effects. This timeline is frustrating but normal. Don't expect your skin to be perfect every day of your cycle. Some fluctuation is natural and normal. You're aiming for overall improvement, not complete elimination of every breakout. Seek professional help when needed. If hormonal acne is severe, causing scarring, not responding to home care, or significantly affecting your quality of life, consult a dermatologist. They can prescribe stronger treatments and work with you to find an effective approach. Consider seeing an endocrinologist if you suspect significant hormonal imbalances beyond just acne. As we close, remember that hormonal acne is complex and often requires both internal and external approaches. Be patient with the process, gentle with your skin, and compassionate with yourself. This is a biological issue, not a personal failing. May your hormonal acne improve with time and proper care. May you find effective treatments. May you have patience for the healing journey. Thank you for this time together. Manage your hormonal acne gently and compassionately.
Or vitamin C initially. After 12+ weeks of stable retinoid use, you might carefully introduce another active on different nights. Many experienced users successfully use retinoid nightly and salicylic acid or benzoyl peroxide on alternate mornings, but this requires well-adapted skin. Retinoid stability matters for effectiveness. Retinol degrades with light and air exposure. Products in opaque, airtight packaging remain stable longer than those in clear or non-airtight packaging. Storing retinoid products in cool, dark places preserves stability. Retinoids become less effective as they degrade, so proper storage extends product effectiveness and lifespan. Retinoid pulse dosing, using retinoids intensively for periods, then taking breaks, is a strategy some dermatologists recommend. The theory is that continuous daily use might cause adaptation, reduced effectiveness, while pulsing maintains efficacy. However, most retinoid experts recommend continuous daily use for consistent results. Occasional breaks for barrier repair are reasonable, but pulsing isn't necessary for maintaining retinoid effectiveness long-term. Combination retinoid protocols use multiple retinoids simultaneously for enhanced benefit. For example, using low-concentration tretinoin at night combined with retinol in the morning. However, this advanced approach requires very well-adapted skin and should only be attempted under professional guidance. It increases irritation risk and isn't necessary for most people. Pregnancy and retinoid use requires special consideration. Retinoids are teratogenic and should not be used during pregnancy. Women of childbearing potential using isotretinoin must use reliable contraception. Tretinoin used during pregnancy is controversial. Some studies suggest it's safe at prescribed topical doses where systemic absorption is minimal, while others recommend avoiding it. Discuss retinoid use with your obstetrician if planning pregnancy or pregnant. Adapting retinoid use seasonally may be beneficial. In winter, when skin is naturally drier, you might reduce retinoid frequency or concentration, or increase moisturizing support. In summer, if your skin tolerates it, you might increase retinoid frequency for more aggressive treatment. Signs of excessive retinoid use include severe dryness, persistent redness beyond the initial retinization phase, barrier compromise, or contact dermatitis. If you experience these, reduce frequency or concentration. There's no badge of honor for using the highest concentration or frequency if your skin is suffering. Optimal retinoid use maintains healthy skin while providing acne and anti-aging benefits. Guide 34. Sleep Quality and Acne, Mechanisms, Optimization Strategies, and Sleep-Specific Skincare. Sleep profoundly affects acne through multiple physiological mechanisms. Understanding sleep acne connections and implementing sleep optimization and sleep-specific skincare significantly improves acne. During sleep, your body undergoes restorative processes crucial for skin health. Growth hormone peaks during deep sleep, supporting skin repair and collagen production. Cortisol, the stress hormone, declines during sleep, reducing inflammation. Immune function is enhanced during sleep, supporting the body's ability to fight infection-causing bacteria. Cellular turnover occurs during sleep, with dead skin cells being replaced by new ones. All these processes directly support clear, healthy skin. Poor sleep disrupts these beneficial processes. Insufficient sleep, less than 7 hours nightly, increases cortisol, promotes inflammation, impairs immune function, and disrupts cellular turnover. The result is worsened acne within days of poor sleep. Many people notice acne worsening after only 1 or 2 nights of insufficient sleep, demonstrating sleep's direct acne effects. Sleep timing matters as much as sleep duration. Your body has a circadian rhythm, an internal clock regulating hormone release and physiological processes. Disrupted circadian rhythm, from shift work, irregular sleep schedules, or jet lag, worsens acne even if total sleep duration is adequate. Maintaining consistent sleep schedules, going to bed and waking up at the same times daily, optimizes circadian rhythm function and supports skin health. Sleep quality matters beyond duration. Fragmented sleep with frequent awakenings, even if total sleep time is adequate, compromises skin health. Poor sleep quality is associated with worse acne. Improving sleep quality requires addressing sleep disruptions through sleep hygiene optimization. Sleep position might influence acne through mechanical and bacterial mechanisms. Sleeping on your back avoids facial contact with pillows and your hands, reducing friction acne and bacterial transfer to your face. Sleeping on your side or stomach involves prolonged face pillow contact, increasing friction and bacterial exposure. However, changing sleep position is difficult if you're not accustomed to it. If you naturally sleep on your side or stomach, prioritize other acne management strategies rather than forcing an uncomfortable sleep position change. Pillowcase cleanliness significantly impacts acne. Dirty pillowcases accumulate bacteria, oil, and dead skin cells, all of which transfer to your face during sleep. Some dermatologists recommend changing pillowcases every 2 to 3 days for acne-prone individuals. Alternatively, sleeping on a clean towel over your pillowcase and changing the towel daily is effective and economical. Some people with severe acne benefit from silk or satin pillowcases, which create less friction and accumulate less bacteria than cotton. Bedroom temperature affects sleep quality. Warmer rooms increase perspiration, creating a moist environment promoting bacterial growth and acne. A cooler bedroom, around 65 to 68 degrees Fahrenheit or 18 to 20 degrees Celsius, supports better sleep and reduces nighttime sweating. If your bedroom is too warm, using a fan or air conditioning improves both sleep quality and acne through multiple mechanisms. Humidity in the bedroom affects skin and sleep. Excessively dry air, from heating systems or dry climate, irritates skin and disrupts sleep. Excessively humid air promotes bacterial growth and acne. Moderate humidity, 30 to 50%, is optimal. Using a humidifier in dry climates or a dehumidifier in humid climates optimizes sleep environment and supports skin health. Light exposure, particularly blue light from screens, suppresses melatonin production, disrupting sleep timing and quality. Using devices before bed worsens sleep through this mechanism. Stopping screen use 30 to 60 minutes before bed improves sleep quality. Using blue light filters on devices if evening screen use is unavoidable provides some protection. Caffeine and alcohol intake timing affects sleep quality. Caffeine consumed in the afternoon or evening disrupts sleep onset and quality. Alcohol consumption in the evening worsens sleep quality even though it might initially make you drowsy. Avoiding caffeine after 2 p.m. and limiting evening alcohol consumption improves sleep. Exercise supports both sleep quality and acne management through multiple mechanisms. Regular aerobic exercise, 30 minutes, 5 times weekly, improves sleep quality, reduces stress, regulates hormones, and improves acne. However, exercising too close to bedtime, within 3 hours, might disrupt sleep. Exercising earlier in the day optimizes both sleep and acne benefits. Sleep-specific skincare involves protective measures during sleep. Applying a heavy, occlusive moisturizer or night cream before bed protects skin during nighttime and supports barrier health. Night creams are often richer than daytime moisturizers because you don't need to worry about appearance or mattifying for makeup. Overnight hydrating masks provide
true for dry, sensitive, or mature skin. If you currently cleanse twice daily with cleanser, try switching to just a water rinse in the morning. Your skin hasn't gotten dirty overnight. There's no makeup, no sunscreen, no pollution to remove. The light layer of natural oil your skin produced overnight is actually protective and beneficial. Let it be. Only cleanse with cleanser when your skin actually needs it, after wearing makeup, sunscreen, or heavy moisturizers, or after sweating significantly. Other times, water is often enough. The second step is to choose a gentler cleanser. Put away any cleansers containing sodium lauryl sulfate, which is particularly stripping. Look for gentle pH balance cleansers. Cream cleansers, milk cleansers, or gentle gel cleansers without harsh surfactants. Your cleanser should have a pH around 5.5, matching your skin's natural pH. The cleanser should not produce a lot of foam. While foam isn't inherently bad, cleansers that create abundant, luxurious lather usually contain stronger surfactants that are more likely to strip your skin. A good gentle cleanser might produce minimal or no foam, and that's perfectly fine. Read the ingredient list. Avoid cleansers with high amounts of alcohol, fragrance at the top of the list, or anything marketed as deep cleaning, clarifying, or purifying. These often indicate harsher formulas. Look for cleansers described as gentle, hydrating, or cream-based. The third step is to adjust your cleansing technique. Use lukewarm water only. never hot. Hot water feels soothing but strips your natural oils and can damage capillaries over time. Similarly, avoid very cold water, which doesn't allow cleansers to work effectively. Apply your cleanser to damp skin and massage gently with your fingertips for about 60 seconds. This is enough time for the cleanser to work without being excessive. Use light, circular motions. Don't scrub, press hard, or pull at your skin. Pretend you're cleansing a baby's face. That's the level of gentleness appropriate for your own face. Rinse thoroughly and completely. Incomplete rinsing can leave residue that irritates skin, but excessive rinsing is also unnecessary. Splash your face repeatedly with lukewarm water until all cleanser is gone. Usually 10 to 15 splashes, then stop. Pat your face dry with a soft, clean towel. Don't rub. Rubbing creates friction and can irritate skin, especially when damp and vulnerable. The fourth step is to eliminate aggressive cleansing tools or use them much more carefully. Put away harsh facial brushes, rough washcloths, and abrasive scrubs. Your hands are the best tools for cleansing. They allow precise pressure control and don't harbor bacteria like reusable tools can. If you enjoy using tools, choose soft silicone cleansing pads used gently, or very soft washcloths used with minimal pressure. Clean any reusable tools thoroughly after each use and replace them regularly. Completely stop using physical exfoliating scrubs with rough particles. These are almost always too harsh and create micro tears in your skin. If you want exfoliation, gentle chemical exfoliants used sparingly are far safer and more effective. Now let's discuss the transition period and what to expect when you stop over-cleansing. When you first reduce cleansing frequency or switch to gentler cleansing, your skin might go through an adjustment period. If you've been over-cleansing, your oil glands have been in overdrive. When you stop stripping your skin, it takes time for oil production to normalize, usually 1 to 3 weeks. During this transition, your skin might feel slightly more oily than usual. This is temporary. Resist the urge to go back to harsh cleansing. Stay the course with gentle cleansing. Use a lightweight moisturizer and be patient. Your skin will rebalance. You might also notice some initial purging or congestion as your skin adjusts and its natural processes normalize. Again, this is temporary and should resolve within a few weeks. If it persists beyond a month, you may need to adjust something else in your routine. But the gentler cleansing itself is still correct. As your skin rebalances, you'll start noticing improvements, less tightness and discomfort, decreased oil production as your skin no longer overcompensates, improved texture and reduced sensitivity, better response to your other skincare products because your barrier is intact, fewer breakouts as your skin can function normally, and an overall healthier appearance. Let's address specific situations and skin types. For oily or acne-prone skin, gentle cleansing is still the answer. Use a gentle gel or foam cleanser once daily in the evening. You can use a BHA treatment separately after cleansing if needed for acne, but the cleansing itself should be gentle. Morning water rinse is often sufficient. If you must cleanse in the morning, use the same gentle cleanser very briefly. For dry or sensitive skin, cleansing once daily is usually enough, and you might even reduce to every other day if your skin tolerates it. Use a cream cleanser or cleansing milk. Consider cleansing oils or balms, which cleanse while nourishing. Morning water rinse is definitely sufficient. For combination skin, one evening cleanse with a balanced, gentle cleanser usually works well. If your T-zone feels it needs morning cleansing, you can cleanse just that area with cleanser while rinsing the rest with water, but this is optional. If you wear heavy makeup or waterproof sunscreen, you might benefit from double cleansing in the evening. First with an oil-based cleanser or micellar water to dissolve makeup and sunscreen, then with your gentle, regular cleanser. But this is still just once per day in the evening, and both cleansers should be gentle. Let's talk about exercise and sweat. After working out, you want to cleanse away sweat, but you still want to be gentle. If you exercise in the morning, that can be your one cleansing of the day. If you exercise midday, cleanse gently after, then just rinse with water that evening. Don't cleanse 3 times per day, even on workout days. Adjust the timing instead. Creating new cleansing habits takes awareness and practice. It might help to set reminders or create new mental associations. When you reach for your cleanser in the morning, pause and ask, does my skin actually need this, or would water be enough? Often, the honest answer is that water is sufficient. When you cleanse, check your water temperature by testing it on your inner wrist first. If it feels hot, it's too hot for your face. Adjust until it feels neutral, barely warm. Time your cleansing. If you're spending more than 60-90 seconds actually cleansing, you're probably overdoing it. 1 minute is enough for the cleanser to work without stripping your skin. As we come toward closing, embrace this important truth. Clean doesn't mean stripped. Healthy cleansing removes what doesn't belong: dirt, excess surface oil, makeup, sunscreen, while preserving what does belong: your skin's protective barrier, beneficial oils, natural pH, and healthy microbiome. Your skin is not inherently dirty or problematic. It's designed to maintain itself with gentle support, not aggressive intervention. When you stop over-cleansing and start cleansing appropriately, you give your skin the chance to return to its natural, healthy balance. Take a deep breath. You now understand over-cleansing and how to stop it. You know that gentle, appropriate cleansing serves your skin far better than harsh, frequent cleansing. May you cleanse with gentleness and intention. May your skin find its natural balance. May you release the need for squeaky clean in favor of truly healthy skin. Thank you for this time together. Cleanse gently and trust your skin's wisdom.
Bacteria and irritants to skin, worsening acne. Clean makeup brushes at least weekly with gentle shampoo or brush cleaner. Replace sponges frequently. Use clean hands or clean applicators when possible rather than dirty brushes. Removal of makeup is crucial. Leaving makeup on overnight allows prolonged contact with pores, promotes bacterial growth, and worsens acne. Thoroughly remove all makeup before bed using an appropriate makeup remover or cleansing oil, followed by your regular cleanser. Double cleansing, first with oil-based remover, then water-based cleanser, is particularly effective for completely removing makeup and sebum. Mineral makeup is often better tolerated by acne-prone skin than conventional makeup. Mineral formulations use zinc oxide, titanium dioxide, and iron oxides as pigments without some of the potentially problematic ingredients in conventional cosmetics. Many mineral makeup lines specifically formulate for acne-prone skin. BB creams and CC creams offer lighter coverage than full foundation while providing some color correction. These lighter formulations are often better tolerated by acne-prone skin than traditional foundations. If you need coverage, consider whether a BB cream provides adequate coverage before resorting to heavier foundation. Tinted moisturizers combine light coverage with hydration, often with less pore clogging potential than foundations. For those with mild acne or seeking light coverage, tinted moisturizers can be a good option. Sunscreen itself should be acne-safe. Many sunscreens worsen acne due to occlusive or comedogenic formulations. Specifically, choose sunscreens for acne-prone skin, labeled non-comedogenic, oil-free, or for acne-prone skin. Mineral sunscreens are often better tolerated than chemical sunscreens. Testing new products carefully is essential. Introduce one new cosmetic at a time, using it for 1 to 2 weeks to assess whether it triggers new breakouts. If breakouts appear, discontinue the product and wait for acne to resolve before trying a different product. Testing one product at a time allows you to identify which products your skin tolerates. Some people find that minimizing overall makeup use helps control acne more than finding the perfect acne-safe products. If you use makeup only when necessary rather than daily, less product contact with skin means fewer breakout triggers. Consider whether you actually need all the makeup you're using or whether you could achieve similar results with less product. Professional makeup application services for special events often use heavy product application techniques. If you need professional makeup done, inform the makeup artist about your acne and request lighter application and acne-safe products if possible. Alternatively, request that you apply your own makeup at home after a professional provides guidance. The bottom line: find acne-safe products suitable for your skin, apply minimally, remove thoroughly, and use clean tools. This approach allows you to use cosmetics without significantly exacerbating acne. Guide 30: Building your perfect personalized skincare routine, complete advanced framework. After understanding numerous acne treatments and supporting strategies, integrating all this knowledge into a personalized, optimized skincare routine that works specifically for your skin is essential. This comprehensive framework guides you through creating your perfect routine. Step 1: Identify your specific acne profile. Are you primarily comedonal, blackheads, whiteheads? Inflammatory, red pimples, pustules? Hormonal, deep cystic lesions? Severe mixed type? Fungal acne? Acne cosmetica? Your acne type guides which treatments are most appropriate. Comedonal acne particularly benefits from salicylic acid. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Fungal acne requires antifungal treatments. Getting your acne type right prevents wasting time on ineffective treatments. Step 2: Assess your skin type and sensitivities. Is your skin oily, dry, combination, or balanced? Very sensitive or robust? Do you have history of allergic reactions? Do you have rosacea or other reactive conditions? This information determines which products and concentrations your skin tolerates. Sensitive skin requires gentler products, lower active ingredient concentrations, and slower introduction of new treatments. Oily skin tolerates stronger treatments and higher concentrations. Dry skin requires careful moisturizing even while using drying treatments. Step 3: Evaluate contributing factors. What worsens your acne? Stress? Hormonal cycles? Certain foods? Sleep deprivation? specific products, environmental factors. Identifying contributing factors allows you to address root causes alongside medical treatment. If stress worsens acne, stress management becomes part of your treatment. If hormonal cycles worsen acne, tracking cycles and timing treatment adjustments helps. Step 4. Set realistic timelines and goals. Most acne improves over 8 to 12 weeks of consistent treatment. Severe acne might take 4 to 6 months or longer. Scars fade over 6 to 12 months with appropriate treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Your goal might be clear skin or manageable acne with occasional breakouts, depending on your acne severity. Step 5. Design your morning routine. Start with a gentle cleanser appropriate for your skin type, used with lukewarm water. Follow with optional essences or hydrating toners if desired. Apply any morning actives, perhaps vitamin C serum for antioxidant protection. Apply your morning moisturizer. Finish with SPF 30+ sunscreen. This entire routine should take 5 to 10 minutes. Keep it simple so it's sustainable. Step 6. Design your evening routine. Start with makeup removal if applicable, oil-based cleanser or micellar water. Follow with your evening cleanser. Apply any evening hydrating toners or essences. Apply your primary acne treatment, perhaps salicylic acid or benzoyl peroxide, starting at low frequency, typically 2 to 3 times weekly. After allowing this to dry, wait 10 to 20 minutes, apply your moisturizer. If using retinoids, apply them now, after at least 2 to 3 weeks of tolerance building. Optional, apply occlusive oil or balm as final step if your skin is dry. Step 7. Plan your treatment introduction sequence. Never introduce multiple new treatments simultaneously. Introduce your first active treatment, perhaps salicylic acid, use it 2 to 3 times weekly for 3 to 4 weeks, then reassess. If tolerating well and seeing some improvement, after 4 weeks consider introducing a second active, perhaps benzoyl peroxide on different days/times. Build your routine gradually over 8 to 12 weeks. This patience is rewarded with better long-term results than aggressive starting. Step 8. Plan adjustments based on response. After 8 to 12 weeks of consistent treatment, reassess. Is acne improving? Are side effects manageable? Do you need to increase treatment intensity? Based on your assessment, you might increase frequency of treatments, increase concentration, add another treatment, or make other adjustments. However, only adjust one variable at a time so you know what caused any changes. Step 9. Incorporate lifestyle factors. Alongside your skincare routine, implement dietary changes, reduce sugar, increase antioxidants, perhaps reduce dairy. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, exercise, or your preferred method. These factors take 4 to 8 weeks to show skin effects but provide significant benefits. Step 10. Plan professional treatments if appropriate. If after 12 weeks of diligent home care your acne hasn't adequately improved, consider professional treatments like chemical peels, laser, or blue light therapy. Monthly professional treatments combined with home care often produce better results than home care alone for moderate to severe acne. Step 11. Plan long-term maintenance. Once your acne clears, identify which treatments were essential for your success and continue them at maintenance levels. Your maintenance routine might be simpler than your treatment routine, perhaps just retinoid at night and sunscreen during the day, but it should continue indefinitely to prevent acne recurrence. Step 12. Build flexibility for adjustments. Your perfect routine isn't static. Seasonal changes, life stress changes, hormonal cycles, and other factors might necessitate routine adjustments. Have a plan for intensifying treatment during high-risk times, increased stress, menstrual cycle high-risk phase. Be willing to adjust your routine based on your skin's response rather than rigidly sticking to something not working. A sample personalized routine for moderate inflammatory acne might look like: morning, gentle cleanser niacinamide serum, optional, lightweight moisturizer SPF 30+ sunscreen. Evening, makeup removal if applicable, gentle cleanser hydrating toner/essence, optional, benzoyl peroxide 2.5%, 3 to 4 times weekly initially, moisturizer optional, retinoid, starting 2 to 3 times weekly after tolerance built. Lifestyle: 7 to 9 hours sleep, 30 minutes exercise 5 times weekly, stress management, diet emphasizing whole foods with reduced sugar. Professional: monthly superficial chemical peels if available. Timeline: 8 to 12 weeks for significant improvement, 6 months for near complete